Okay. So we will continue the self-assessment review from inbox. Well, we were reviewing this like just a few minutes ago. I just wanted to verify that we were reviewing it. Well, we were reviewing the fourth question. We said the answer was acetylcholine. We reviewed that, well, it was basically because acetylcholine acts in the adrenal medulla and then it uh, produces, or stimulates the chromaffin cells to secrete catecholamines. And here we're gonna see the picture of how it is happen. So well, basically here is the acetylcholine. It's released via exocytosis and it acts in the NAK pump and it release or stimulate the chromaffin cell to release the catecholamines. Most important one is epinephrine in 80% and 20% norepinephrine, but there are more norepinephrine in all over our body. Here is a picture because it is released actually for the postganglionic fibers. So there are more norepinephrine than epinephrine actually in all our body. Well, so then we're gonna review next question. Um, Sorry, just wanted to make sure. And well, here I said like we have to review the page 327 for of the first aid, and here you can review about pheochromocytoma. I actually have it like um you know the actual book, but you can review the online version. Well, so the next question number 5 says a full-term male newborn is evaluated for low urine output 24 hours after birth. The pregnancy was uncomplicated. A renal ultrasound showed dilatation of the left renal pelvis and calyces. In which of the following embryologic tissues did an error development most likely occur? This is actually here we can review. Let's write but. Uh, oh my god, I forgot actually that but you can find it in a lot of places. Mm, meso, meta. Oh my god. Mm, rhetoric. Um, it's actually nephrology. That's endo, gastro. Um, renal. Here it is. So here it's like the high yield of renal, and then we review kidney embryology. So I'll search it in my actual book to tell you what was my high yield of this. Well, there are three important stuff. Basically, the pronephros, mesonephros, and methanephros. Pronephros is important because it's the beginning, it's the week 4. Then it degenerates, so it actually doesn't have nothing to do with, but was the first. Then mesonephros, which is actually important because then you will have the male genitalia system of the Wolfgang duct, and then the metanephers, that is actually the most important one. It permanent first appeared at the week 5 of development, and then it is completed at the 36 of gestation. But it's actually pretty important is this thing that the ureteric bud and the methanephric mesenchyme, it developed like this one induced this one, and this is important because this interaction is actually pretty questionable. And well, the other thing is that from here you will have the calyces, the ureter, the pelvis size, the collecting ducts, and it's fully canalized by the week 10. And it is important because this is actually the thing that's wrong in the question. So this one is the answer. And the methanephric mesenchyme, as it says, it interacts with the bud, and this interaction induces differentiation of what of the glomerulus to the distal. So this is to the glomerulus to the distal, and this one is to the collecting duct and all the stuff that came by. And well, it says aberrant interaction between these two tissues might result in several congenital malformations of the kidney. And this one it's kind of important too, the ureteropelvic junction. It's the most common pathologic cause of prenatal hydronephrosis, and it's detected by ultrasound. This is actually pretty high yield too, is the polar sequence. But the thing that they ask the most about this is that it is a sequence and not a syndrome. And actually, they ask you about like the stuff that it's here, right? Like pulmonary hypoplasia, oligodramnios, twist face, twist skin, extremity defects, renal failure in utero. This stuff is actually something that they ask a lot. So, um, so we continue. I'm actually going to change the name here. It's self-assessment step 1. Reviewing self-assessment step 1. Okay. Sorry if I'm taking my time and you will see this, but I have to change, the title. Yeah, okay. Next question. It says a 26-year-old man is brought to the emergency department by the police. That's actually not that important, but what is important is agitation and impaired cognition. He hit the head at the local bar after starting a fight. So you can imagine this guy is like kind of angry. He also smelled like alcohol, so he was drinking. And they said he's confused, he's hypertensive. This is super high yield. The respirations are above the normal. This is important because if you're thinking about alcohol intoxication, you will see like there's more depressed because alcohol is depressed. It's a one of the when they study this stuff like the intoxications, they tell you the ones that are stimulants and the ones that are depressors, and alcohol is a depressor, but this does not look like a depressor. He's confused, he's oriented only in person. He has meiosis and nystagmus. This one is important. You will see nystagmus in alcohol too, I think, but meiosis is not something common there, and he actually it's pretty violent. What it says is This drug works primary. This is actually something that they ask a lot, at least in your word, that they works via activation of the paninervic neurons and NMDA antagonism. And the answer actually it says it's phencyclidine. Let's search actually because here you will review actually all the stuff that you need. Okay, so here it is. Um, Here you have all the review. Actually, this is the 2022 first aid, just for you to know. Okay, this is part of psychiatry, in the part of pathology, um, and it says psychoactive drug intoxication and withdrawal. So there is alcohol. First of all, you have to review about alcohol or what is important about alcohol. Emotional lability, slur to speech, ataxia, coma, blackouts, and well, that's it. For the part of the that it's actually important to that it's that you have GGT elevated and also ACT. It's the double of ALT. They said toast to alcohol. This is something that they ask a lot too. Treatment, supportive fluids, and antiemetics. And that's it. Treatment, longer acting benzodiazepines, non-specific. They say this. And well, what you had here is there are tremors, insomnia, diaphoresis, agitation, GI upset, and then you have alcoholic hallucinations, usually visuals, and after that, delirium tremens actually, sorry. And they say it like for the hour, so you should know that delirium tremors it's after 48 hours. So then we have barbiturates. Barbiturates they have low safety margin, so if you take more than the the safe dose, you can have problems. Delirium, life-threatening, cardiovascular. If you can see all of this stuff, it's the same for all, like disinhibition and respiratory depression. And that was something that I was telling you here in the question is that you see here that the respiration is actually above the normal. So there's no like respiratory depression now. Benzodiazepines, greater safety margin, that's important. And the treatment, flumazenil, this is actually important too. It's something that they could ask you. And sleep disturbance, important too. Opioids, pupillary constriction, pinpoint pupils. This is important too. Um, Diarrhea, flu-like symptoms like as you see here, they're all like cholinergic, right? Cramp, sweating, pilorection, cold turkey, treatment, symptoms, management, and methadone and buprenorphine. Um, Overdose treatment. The first one is naloxone. What's the problem with naloxone? Or this actually they ask about. I remember when I was doing you or they ask you that this has like a short lifetime life. So you will have to be sure about this. Like really see if the patient is having like again problems about of this intoxication is because like this have the short lifetime. Absence of gag reflex, seizures, most common cause of um, drug overdose, it's death, right? And inhalants, they actually ask this, they ask you that the patient have something like in the nose, like, or a rash, because that's what it says here actually. But the effects have rapid onset and resolution, so you will like see a question that says like a patient that was like euphoric and with the disturbed gait, disoriented, and after 30 minutes he's okay. So this is actually one of the things that they ask. Then there are the stimulants. This one that's the treatment of some diseases, and caffeine too. Um, so what's important here? It's mood elevation, grandiosity, psychomotor agitation, insomnia, cardiac arrhythmias, tachycardia, anxiety, non-specific post-use crash, including depression, lethargy. So if you see this like actually make you have like um kind of um sorry, I have the word. I will try to remember it. Just give me a second. Um Bipolar disorder, like you are in the grandiosity state and then you go down. It's actually what they like stimulate. So you are like in the maniac phase and then you just go down. But actually not the effect that they want, right? Amphetamines, you do it for some kind of disorders like TDAH, euphoria, grandiosity, popularity, dilation, prolonged wakefulness, hyperalertness, hypertension, paranoia, fever, fractured teeth. This is actually important if you have a kid and he have like all this stuff. You have to be careful that he does not brooks, because he could fracture the teeth, is one of the questions I saw. Skin excoriation, severe cardiac arrest, seizure treatment, benzodiazepines for agitation and seizures. And actually this is something that they ask: vivid nightmares. Caffeine, they actually do not question about this, to be truthful. Um, then cocaine, pupillary dilatation. It's important. Opioids make meiosis, cocaine make mydriasis, diaphoresis, hallucinations, including tactile, paranoia, angina, cardiac death, chronic use led to perforate nasal septum. They actually ask that too. Vasoconstriction, the ischemic necrosis, treatment benzodiazepines, um, and they actually ask this: his hunger. Nicotine, they do not ask this a lot, but they could ask you that actually there's one question I see of this self-assessment is the treatment. Bupropion or varenicline. They will ask you where does varenicline acts. Um, we will see that later. Actually, you can use nicotine therapy replacement, but well, they ask you for this drug. Where does it work? Hallucinants. Well, I think we can review this later. Like, oh my God, we have to review actually what's in the question. What they ask is about phencyclidine, and they ask you, and he is violent, he has nystagmus, impulsivity, agitation, meiosis, tachycardia, hypertension. The high yields for these questions are hypertension and nystagmus and violent. Because as you see, agitation, meiosis, tachycardia, psychosis, delirium, seizures, you can see in another ones, but like violent, could be in alcohol too, but nystagmus and hypertension, this is the most high yield, like hypertension. Okay. Um, okay. Just for your knowledge, Uh, Here sets 21 to 34. The cinemate behavior, nystagmus, tachycardia too. As I told you, nystagmus is in alcohol too. Um, Methamphetamine, as I told you, is a sympathomimetic drug, causes tachycardia, hypertension, violent behavior too. But actually, there are more grandiosity, psychosis, euphoria, diaphoresis, bruxism, myodrasis, not meiosis. So this is important too. Heroin, so it's an opioid, so it says meiosis. However, it most commonly induces respiratory depression, as I told you, because it's a depressant, bradycardia, hypotension, the opposite features. And then nystagmus is not a feature of heroin. So yeah, there it is. Actually, it's not in a withdrawal, right? Withdrawal. Cocaine, as I told you, it's mydriasis, that it's not in this case, because here we have meiosis, but also tachycardia, hypertension, agitation can be, but there's nausea, diaphoresis, change of pain, not nystagmus. So there are a lot of things in common, but actually the one that like fits the most is this one, phencyclidine. So that's the answer. So let's go to the other question. 55 year old man. He's an alcoholic. He been drinking. He have like an alcohol binge 2 days ago. He drink 3 pints of hard liquor. He takes warfarin daily. He has like a pathomegaly, and his INR it's above the normal one. This increase it's a result in which of the following. So the question is pretty easy to answer. I think so because the INR occur because warfarin is a substrate of cytochrome P45 40 450. And alcohol has acute injury, a region of the liver that express these enzymes so well. Um, but actually, what you have to know is that there's an increase of this SIP because there's an injury of this place, not because of the warfarin, but because of this new binge. Of course, the warfarin actually works there and elevates the INR, but not that much as we can see here because this patient have this acute intoxication. So here they explain all the stuff, but you can see better in the FA. Um, Sinusoids. Oh my god. Um, mm, Here we have it. So here are the three zones that this is super like high yield too, because they can ask you what damage which zone, or as we can see in this question, like what thing happened, right? So here we have the three zones. The one that's near to the central vein, it's the zone 3, and the one that's like um near the artery, the hepatic artery, the portal vein, or the bile duct is the zone 3, and in the middle is the zone 2. So, the first zone, as we can see, is the periportal zone, and it is affected about with viral hepatitis. That it's not the case, but if we can see a case of viral hepatitis, we can imagine that the zone that it's damaged is the zone 1, that it's the periportal zone. It could be another question. Um, the most oxygenate zone, and also ingested toxins like cocaine. So if they ask you like what zone damage cocaine, you can answer zone 1 or periportal zone. Zone 2, like, 2, yellow fever, right? And the zone 3, that's the question. And here it says high concentration of CP 450. So this is the answer, right? And it's the pericentral or centrilobular zone because it's here. Here's the lobuli. And most sensitive to metabolic toxins like ethanol. So here we have all the answer actually. This is all the answer of this question. I did it wrong because I didn't like remember this stuff, but now I know there's something that they can ask. um, so well. Other thing that they can ask you is about this, the stellate cell. Here it is. Hepatic stellate or ETO cells are in the space of this, and it's important because they produce the extracellular matrix that is responsible for hepatic fibrosis that could lead to cirrhosis. And also, they store vitamin A. Well, Kupffer cells are the macrophages um, that clear bacteria and damage or senescent RBCs. And well, this is the most important thing about liver tissue. Here we have like the portal vein. Um, let's let's see. Well, so that's it. That's all we need to know. Okay, next question. So this was incorrect. The answer was the zone 3 or centrilobular hepatocytes because here we found the CYP and here there's most sensitive to metabolic toxin. So you see, it's actually the same thing. The first day gave you the answer. The hepatic stela, as I told you, the extracellular matrix components, they lead to cirrhosis. Periportal hepatocytes that are, periportal, so near the portal, it's zone 1. And as I told you, this is not the place of the INR actually, but there's like cocaine and all this stuff. Cocaine, but not alcohol. Well, cocaine and hepatitis, viral hepatitis actually. Okay. So let's continue. Kupffer cells, what they said. Kupffer says clear age erythrocytes, infection particles, and extracellular debris because they are like the macrophages of the liver. So that's what macrophages do actually. A 26-year-old woman comes to the physician because of 1 week history of dysuria and painful lesions of the genitals. She is sexually active with 2 male partners and uses condoms occasionally. Pelvic examination shows several shallow ulcers on the labia majora and labia minora. A smear taken from the vesicles show multinucleate giant cells. Pharmacotherapy with a guanosine analog is initiated. After 2 weeks of treatment, her symptoms recur and are no longer responsive to this medication. which of the following is the most likely mechanism of resistance to this medication? So you can read this and you can tell us that this patient have herpes simplex virus 2 because it's the genital one, and what you have to treat this patient with is with guanosine analogs that are acyclovir, valacyclovir, and famciclovir. Um, and they act like this. Here. Well, this is actually a good overview of the antiviral agents and their mechanism of action. So we have like this sketch. I really recommend you to review this sketch because you will see like the retroviruses and the other viruses that you have to know, even though the virus is RNA or DNA, and where does the drugs work in. For example, here the neuraminidase inhibitors, so you use for influenza or other ones, right? So in this case, of course, it's a DNA virus that works in the guanosine analogs here. There are cyclovir, pecyclovir, valacyclovir, and stuff. But I prefer to read the FA. So here it is. Okay. So, well, here we have it. These first ones are the one that you use for herpes virus, and this one is the one that you use for cytomegalovirus. This is actually the most important thing, and it is because cytomegalovirus needs a viral. It's formed by the viral kinase of CMV. Um, mechanism. Um, Guanosine analogs monophosphorylate by um, the thymidine kidasa and not phosphorylate in uninfected cells. Few adverse effects. Then the monophosphorylate becomes 3-phosphate, and then inhibit the viral DNA polymerase. And it says, right, the mechanism resistant is mutated viral thymidine kinase. If the case was of a patient with cytomegalovirus, the answer would be mutated viral kinase because CMV have a viral kinase, not this thymidine kinase. And that's it. That's actually the answer. No effect in latent forms of this. That's important to remember. HSV or varicella zoster virus or herpes zoster virus. Herpes simple, sorry. Okay. Actually, I didn't review what was the second most important answer. Sorry. 30% says mutation in DNA dependent RNA polymerase. This is for herpes virus such as HSV2 or okay, this is for mycobacterium. This is for rifampin. Mm, this is for rifampin. Here you can see rifampin. Sorry. Rifampin is an antimicrobial, but it's sorry, an antibiotic. Okay, here it's the mechanism of resistance, mutations in the RNA polymerase, mycobacterium tuberculosis. Well, actually, it's important to review this. Like, um, for mycobacterium tuberculosis, you have to treat all this stuff. Like, for example, ethambutol acts in the arabinogalactan, the isoniazid in the mycolic acid. This is important, they ask you a lot. Rifampin in the RNA polymerase, so it's in the interior of the cell. The pyrosinamide, that it's unclear mechanism, and streptomycin, that it's not here, but this is in the 30S ribosomal subunit. So this is actually pretty asked. And other thing that they ask a lot is like the adverse effect isoniazid, ENH as the name, injures neurons and hepatocytes. Pyrosinamide, hyperuricemia, and hepatotoxin. Pyrosinamine with P of protein. Proteins lead you to hyperuricemia. Tambutol, for here said itembutol optic neuropathy, and streptomycin as all the macrolides, so you can uh, remember it: tinnitus, vertigo, ataxia, nephrotoxicity. Remember that. Um, that's it. Mm, mm, mm. 17-year-old boy comes to a physician for an evaluation of bilateral breast enlargement. He's at 99 percentile for age and 45 percentile for weight. Examination shows long extremities, reduced facial and body hair, bilateral growth of breast tissue. There is high frequency mid-systolic click. Genital shows small testes. Which of the following is the most underlying mechanism of patient's condition? So all this stuff, it's Klinefelter syndrome, tall stature, gynecomastia, testicular hyperplasia, mitral valve prolapse, all the eunuchoid habit. And it's because of failure of the sex chromosome to separate during meiosis, no disjunction. So here it is, like all the features you need to remember. Mitral valve prolapse is something that they ask a lot. So you have like the mid systolic. That's it. Sorry. Okay. So kleine. So here you have the same stuff. Lesinibin, they can ask you this. What's like decrease in Klinefelter syndrome, inhibin B? What's increased FSH, LH? There's risk of breast cancer. This is to actually a question. Um, the bar body, it's actually questionable because there's no bar body in Turner. Turner shock gene, important too. Azoospermia, if they ask you about infertility, they will ask you about azoospermia. What you look in Klinefelter is azoospermia. Um, as I told you, eunuchoid proportions. Actually, you can see here Klinefelter syndrome, for testicular tumors, for germ cell tumors. And here for you, if you want to review, this is the part of genetics in biochemistry. You need to know um, modes of inheritance. This is something that they ask a lot. They ask a lot. Brother have no papa, Angelman have no mama. Maternal allele deleted in Angelman. Seizures, ataxia, intellectual disability, inappropriate Luther, UBE3A, copy of chromosome 15. 5% are due to paternal uniparental disomy. Pop, brother Willie, obesity, paternal allele. Maternal silence. This is a good one. Paternal allele is deleted. Hyperphagia, obesity, intellectual disability, hypogonadism, hypotonia. These two are part of disorder of imprinting. That it's one gene copy is silenced by methylation and the only other copy is expressed. Parent of origin effects. The expressed copy might be mutated, might not be expressed, or might be deleted altogether. This actually it's pretty it's something that they ask a lot. They ask you the modes of inheritance. Autosomal dominant, often due to defects in the structural genes. Many generations, both males and females are affected. This is important too. Like here, you have the mom have it, and then she have the recessive of the dad, so she doesn't have it, but she have no. Recessive, you need to have both copies of the recessive. So here's like the important thing is that as you have the dominant, you just need one copy. So there's 50% of chance of being affected to pass off brings. That's something they said. But here, it depends if you have two of course, you have two carriers. So the child have 25% of being affected, 50 change percent of being a carrier, and 25% chance of not being affected or not being a carrier. X-linked disorders, just for the mom. So usually the mom is a carrier, the daughters are carriers, but the males usually are affected. Sons, heterozygous mothers have 50% chance of being affected, but of course have the 50 because the mom have two X. So if one of the X, it's just a carrier, the kid that have the X that's damaged will have the disease. Commonly more severe in males, female usually must be homozygous to be affected. X-linked dominant, transmitted through both parents, children of affected mothers each have 50% chance of being affected. It was X-linked recessive, but if X through both parents, 100% of daughters and 0% of sons of affected fathers will be affected. Okay. So in the X-linked dominant, for example, here we have that the father is the one that's affected, Of course, the girls, that XX, will always be affected, and the boys, of course, the XY, they all be without the disease. But in the case of the mom, the girls have the XX, have the 50, you know, and the ex-wife, of course, have the 50. So yeah, have the 50 chance of being affected. X-fragile Alport syndrome, hypophosphatemic rickets, also called X-linked hypophosphatemia. Rickets-like presentation. Here it's a problem in the phosphate wasting in the proximal tube. In the proximal tube, they ask you about this. Mitochondrial inheritance, they ask you about these too, only through the mom, because the mom is the one that pass to the offspring the mitochondria. So yeah, here you have it. hmm Here you have it. The good example. Here, this man that was affected could not pass it. The girl passed to the both. But there is variable expression in the population, even within the family, due to heteroplasmy. They ask you about this about a lot, a lot, a lot, a lot. Example: mitochondrial myopathies, liver hereditary optic neuropathy. Okay. Loss of paternal X chromosome. This is Turner. Short, the neck, the heart, bicuspid aortic valve, cubitus valgus, the kidney, the horseshoe kidney, gonadal dysgenesis, osteoporosis. Okay, next question. A 39-year-old woman comes to the emergency department because of a 5-week history of severe epigastric pain, increased thirst, urinary frequency, and greasy stools. She has a history of recurrent kidney stones. Abdominal examination shows epigastric tenderness. Fasting serum studies show an increase in gastrin concentration. Fajo gastronopathy show multiple abdominal ulcers and prominent gastric folds, which definitional findings is most likely in this patient. So here they told you esthathoria, multiple duodenal ulcers and prominent gastric folds, increased gastric. Yes, that's what I was thinking. Solier Edison syndrome, that means it's a gastrinoma. But in a patient who have this other stuff, because kidney stones, polydipsia, and polyuria could be because there are an increase in calcium, and it can be because of a primary hyperparathyroidism. And what else do you? This is a rare suspicion of men one. Mm, I just want to put the picture. Yeah. So here we are, the men, the men. That's something I was telling you. Um, men one, it's because of a mutation of the men one gene. This is a suppressor gene, and red gene it's a proto-oncogene. So men one is for the suppression, and men two A and men two B is because of a proto. Men one it's the three P's: pituitary adenoma, parathyroid adenoma, and pancreatic cancers. There was a pancreatic cancer, yes, the gastrinoma that was giving you the statoria, that was giving you the ulcers, the gastric ulcers or the duodenal ulcers. That makes sense. Then you have the calcium, the hypercalcemia symptoms. What's left? The pituitary adenoma. And what is the most frequent pituitary adenoma? The prolactinoma. So that was the answer. And what the prolactinoma could make you have amenorrhea. Yeah, could happen, amenorrhea. So that's the answer. And men to A and men to B. Men to A and men to B have both in common the pheochromocytoma and the medullary thyroid carcinoma. But the men to B have the mucosal sorry, neuromas and the marfanite habitus. So that's it. Good review for men. This is a mucosal neuroma of the men to be. Yeah, well, they have these mnemothenics. For me, the only one that I remember for to be sure is the three P's. To be fair, then the other ones I know that they have like both Theos and parathyroids, and well, actually the medullary. Oh, so amenorrhea because it's common symptom of pituitary adenoma, decreased secretion of serum gonadotropins. If it was a firm thyroid nodule, yeah, meant to A or meant to B. Hypertensive crisis, meant to A or meant to B, due to a pheochromocytoma. Intestinal ganglioneuromas, typically seen to A, but not to. Yeah, next. A 24 year old woman comes to the physician because of 1 week history of greasy, full stool, full smelling diarrhea. She's a swimmer, Costa Rica, test stool cool for blood negative, multiple vein nuclear trophocytes with 4 pairs of flagelles and some scattered cyst. Giardia. If you see Giardiasis, I remember I used to draw this stuff when I was at med school. Let's watch how Yardia looks like. What's the picture of the Yardia? They do not have it. I was expecting to see the picture. Here it is, the Yardia. This is not the best picture of a Yardia, but you can see this is actually how they describe it. Okay, the appropriate pharmacotherapy is prescribed. 3 days later, the patient returns to the office. She said her mouth has started to taste like pennies. So she took metronidazole because that tastes like pennies is common for metronidazole. Which of the following is the mechanism of action of the prescribed drug? Well, the answer was okay. I will be fair. I was like pretty confident about this this question, and now I realize I'm all wrong. Um, well, but this is a good question. Mechanism. This is a good Picture mechanism of action of antibiotics. So external polymyxins in the outer membrane, only for gram negative, you know. Um, in the cell wall, beta lactam, antibiotics, glycopeptides, and epoxides. And in the cell membrane, daptomycin. Then B, nucleic acids and related enzymes. Um, since you have the DNA, RNA, and the protein. So at the beginning, nitroamidazoles, then fluoroquinolones in the DNA GRAs, and rifamycins, as we review, in the RNA polymerase. Say in the bacterial ribosomes, here, you know, macrolides, amphanicols, lincosamines, oxazolidinones in the 5S subunit, in the 30S subunit, aminoglycosides, tetracyclines, glycyclines. And in the folic acid metabolism, sulfonamides here in the they have the PABA to the DHF and the aminopyrimidines. So that's the reason you gave trimethoprim sulfamethoxam. Okay. So the formation of free radical metabolites that damage the bacterial DNA is a mechanism of action of the nitroimidazoles, such as metronidazole and tinidazole, which are used in the treatment of giardiasis. Adverse effects of systemic nitroimidazoles include metallic taste, gastrointestinal symptoms, headaches, and that stuff. Teddy, as I told you, aminoglycosides, basically, and tetracyclines. Inhibition of peptide cross-linking, beta-lactams. And the microtubule, inhibition of microtubule synthesis is the mechanism of action of albendazole, but albendazole is an antiparasitic, not an antibiotic. Okay, next question. A 34-year-old man comes to a physician for a follow-up visit. He works as a manager at a large telecommunication company. 8 months ago, he was ordered to take an anti-aggression counseling session after employees complain about him constantly lashing out at them. Today, he proudly presents the result of a recent employee survey to attest to a major improvement to overall work atmosphere. He states, ever since I started playing rugby, I feel like a new person. Which of the defense best mechanisms best describe this change of this patient behavior? I really regret putting suppression. It was sublimation. Suppression was a mechanism, was not actually, moving to another step. It is more like, for example, I took this one today. This is actually a question of the U world. You take the exam today and you could be anxious about the results, but you, in a really mature way, decided to not think about this because to be angry or to be mad or to be worried will not change the result. So you just continue with your life until the day of the stuff. So yeah, these both are mature ways to react to the suppression and sublimation are mature key mechanism. Sublimation is a mature defense mechanism. in which an acceptable impulse of behavior is shifted to the social acceptable activities. Displacement mm, is an immature. He's aggressive, playing rugby, punch the wall to his coworker. Reaction is that you make it bigger. Transfer is a phenomenon in which the individual projects feelings, positive and or negative, about important persons onto the clinicians. This is important because it's in the clinician. There is no indication. Okay. I would really like to show you um, the. Well, I know that probably no one is going to see this, but if someone do, oh my god, my crisscross sublimation. Oh my god. Crisscross, crisscross. Okay, ladies. This is important for you to remember all this stuff. You should like really just remember all of these key mechanism, key defense mechanism. They ask you a lot about this. Transference, patient projects feelings to the physician. Counter transfers, the physician projects feelings to the patient. Ego defense. There are mature and immature. In the immature, acting out. A patient skips therapy appointment after deep discomfort from dealing with his past. So you just like decided to copy. Well, it says subconsciously coping with the stressors or emotional conflict using actions rather than reflections or feelings. Denial, avoiding the awareness of some painful reality. For example, patient with cancer decides to go to the trouble and skip the chemotherapy. Displacements, redirection of emotions or impulses to a neutral person or object. Versus projection. This is like displacement versus projection is something that they ask you a lot. For example, after being reprimanded by her principal, a frustrated teacher returns home and criticizes her wife cooking instead of confronting her principal directly. So you're mad because someone randomly tell you something that you don't like, and you go to your wife and you know act like a bad person. And in projection, it's like attributing an unacceptable internal impulse to an external source. For example, versus displacement. For example, a man who wants to cheat on his wife accuses his wife of being unfaithful. So projection is like you do the same that you're feeling to the other. You know, like exactly like he wants to cheat, so he accused her of being unfaithful. But in this case, they're like to another person that doesn't have nothing to do with stuff, and actually he just criticized her wife cooking. That doesn't have nothing to do with the fact that he's a teacher and stuff. Dissociation. Well, this could happen when something traumatic happens. In this case, for example, a survival of sexual abuse. Fixation. A college student studying for a stressful exam begins sucking her thumb. So something more childish level of development versus regression. Idealization. A patient boasts about his physician and his accomplishment while ignoring any flaws. Identification. A resident starts putting her stethoscope in her pocket like a favorite attendant instead of wearing it around her neck like before. Intellectualization. A patient diagnosed with cancer discusses the pathophysiology of the disease. Isolation. Describing murder in graphic detail with no emotional response, separating feelings from idea and events. Passive aggression, disrupt employees repeatedly at work but won't admit it. Rationalization, an employee who was recently fired claims to the job was not important anyway. So it could, this is an immature because you're separating the fact that you probably did something wrong or whatever. Avoid the self blame. Reaction formation. Replace the word of idea or feeling and emphasize on its opposite. For example, a stepfather treats a child he resents with excessive nurturing and overprotection. No? Right? Splitting, a patient says that all the nurses are cold and intensive, but the physicians are warm and friendly. Everything is good or bad. Regression, a 20-year-old doesn't remember going counseling during his father's divorce 10 years earlier. So you could have an idea, but they're probably not the real stuff. That's repression. And regression, a previously toilet trained child begins bedwetting again following the birth of a sibling. And matures adults wear a sash. Sublimation, as I told you, most common examples to the sports, suppressions, not worry, altruism, helping people or donating stuff to charity, humor, and nervous medical student make jokes about the boards. So that's it. A 43-year-old comes to the emergency department.